app.
Hospitals are coming together to pool their resources and optimize Central Indiana's response to the pandemic. WRTV's Stephanie Wade spoke with a number of hospital administrators from across the area and shares what they need from the public as a potential crisis looms.
We are here today.
Hospital heads from Ascension St. Vincent, Community Health Network, Eskenazi Health, Franciscan Health, IU Health, and more came together today to address the current state of the pandemic in Central Indiana. The Hoosier State recently named a national COVID-19 hotspot with one of the highest rates of new cases per 100,000 people in the country. Local hospitals are facing a potential crisis, they say, as the surge of COVID-19 cases continues unabated. Beds, ventilators, and other support systems are being stressed to their limits.
Our staff, our nurses, and all of the healthcare team, doctors, respiratory therapists, chaplains, clinical support teams, the people who clean your rooms have been dealing with COVID patients for almost 10 months. This work is physically and emotionally exhausting.
IU Health has over 1,100 employees on quarantine alone, many working extra shifts to fill the need. But news of the vaccine to be delivered and distributed Wednesday to IU Health Methodist Hospital as one of the 5 hospitals in the state first to receive the vaccine brought excitement. Doctors say, like other aerosol transmitted viruses, COVID-19 lasts longer in the drier winter air. That, coupled with the cold weather forcing people indoors with poor ventilation, they're begging people to socially distance and limit who you spend time with to your own household. Stephanie Wade, WRTV.
Well, hospitals are not allowed to require their staff to get the vaccine based on the emergency use authorization language. They also said today they don't plan on separating employees who received the vaccine from those who didn't, but instead will protect all of their employees the same. It's also important to point out here, it's still unclear whether the vaccine reduces your symptoms or actually reduces the ability to spread the virus. Now to today's numbers. The State Department of Health reporting 35 more deaths of people with COVID. Those deaths occurred between November 28th and yesterday. The state also reports just more than 5,000 new cases of coronavirus. Those results recorded between October 29th and yesterday. A hopeful number is the decline of people hospitalized with COVID. They are the lowest in nearly a month and continued a steady downward trend that started last Tuesday. As of yesterday, there were 3,072 people in the hospital with COVID or suspected cases of COVID. The last time it was about that low was November 18th at 3,063.